Hello, my name is Garfield Clunie. I'm a maternal fetal medicine specialist in New York City at Mount Sinai. Maternal fetal medicine is a specialty where we take care of pregnant women that have medical problems like hypertension, diabetes, and asthma, or they may have fetal issues like fetal abnormalities or fetal growth restriction and things like that. So I work at the Mount Sinai Health System in New York City.
Hello, everyone. My name is Jo-Ann Perrin. I'm the Patient Safety Coordinator for Obstetrics at Mount Sinai West. I've been a labor and delivery nurse for over 20 years, and I'm also a certified childbirth educator.
Hi, everyone. My name is Desmond Sutton. I'm the Medical Director of Labor and Delivery here at Mount Sinai West Hospital, and I'm also a maternal fetal medicine subspecialist at Garfield Clunie.
National Minority Health Month was established back in about 10 years ago by the the National Minority Health Month Foundation, which is now the National Minority Quality Forum led by Dr. Gary Puckering. And it was created in a response to the United States Department of Health and Human Services Health Promotion and Disease Prevention Initiative, which was part of the Healthy People 2020, which has since become the 2020, Healthy People 2030. And essentially, it's data-driven national directives to improve health and well-being over the next decade. The theme for it this year is actually give your community a boost. And as you can imagine, this really has to do with getting everyone vaccinated and boosted with COVID. It focuses on giving you tools and information that you can circulate to your community and your networks so that people can feel comfortable taking the vaccine and the booster and understand why it's necessary. Because as you know, the CDC has put out a lot of data, a lot of racial and ethnic data showing that Blacks, Latinos, American Indians, Alaskan Native people all have poorer outcomes with when they get COVID 19. They're sicker, hospitalized more, and they die at higher rates. Therefore, it is very important to not only get the vaccine, but also follow up and get the booster. And while I'm on the booster, I'll just say that remember that everyone 12 years, 5 years and above is eligible for the vaccine, but everyone 12 years and above is eligible for the booster. And it's very much recommended. And it's also recommended, especially for pregnant women. And the reason why is in pregnancy, your body is somewhat immunosuppressed as you're carrying that pregnancy. So pregnant women do much poorer when it comes to viral diseases and infectious diseases than the standard population. And so pregnant women really need that extra protection from the COVID-19 vaccine. So the Give Yourself a Boost initiative not only supports COVID vaccine and booster, but also supports the many efforts that are happening across the country to advance health equity. Therefore, the National Minority Health Month is an important, inclusive initiative that addresses the health of African Americans, Native Americans, Asians, and other minorities with a goal to strengthen the community information and also try to lessen the burden of disease within the community, and essentially looking to do preventative medicine as well as as well as early detection and control medical diseases. And in terms of and the pregnancy side of things, preconception and interconception is extremely important, and that's part of the early prevention and early detection that occurs with the non-pregnant patients, equivalent to that. So it's very important if you have a pregnancy issue that you talk to your doctor before you even get pregnant to discuss what your pregnancy outcome may be and discuss things that can be done to make you have the best pregnancy outcome possible.
I think there's been historic injustices done to Black and Brown people by the health system, and we did a lot of things to correct that. One of the unfortunate consequences that people have stayed away from the hospital, and studies show that lack of adequate prenatal care and just primary care leads to worse outcomes. So it's really important that we recognize this month to re-engage Black and Brown people to stay in touch with their physicians and actually participate in their own care, especially prenatal care.
So I'm going to answer from a sort of informational standpoint, and I think with this National Minority Health Month, going to the minorityhealth.hhs.gov site has a wealth of information that you can again take to your constituents, send to your networks and the people that you come in contact with, and let them know. And it gives you information on all the events that are happening this year in terms of health and wellness, prevention, screening, all the things that are necessary for optimal health outcomes. They also on the website provide a lot of resources for you to regarding information that you can send to your networks. And there's also a toolkit there if you want to do a campaign on your own. It gives you that information. Additional to that, the ACOG website, the American College of OBGYN, has a wealth of information for the public, for public consumption, that also talks about maternal health and trying to reduce disparities and trying to reduce poor outcomes in mothers. Dr. Sutton, I'm going to pass it over to you.
Yeah, I actually was going to say a lot of those things. The only thing I can add is, spreading awareness. Knowledge is power. And we know that it's much easier to stop someone from getting sick than trying to treat them once they already are sick. So it goes back to what I was saying before, that, preventative care and maintaining contact with your physicians and your primary care doctors is vitally important to your health and the health of the community. Yeah, so overall, when it comes to maternal mortality, globally, we've seen that the rates have decreased. From 1990 to 2015, it's fallen something like 44% worldwide. Sadly, the same is not true for maternal mortality ratios for our Black birthing people. In fact, it's the exact opposite. Black birthing people are sometimes 3 times higher than white birthing people. And sometimes 3.5 times higher than Hispanic birthing people to have morbid events or mortalities in pregnancy. The causes are not immediately clear, but what we do see is some interesting trends in that even when you try to look at maternal morbidity and mortality disparities at different education levels and socioeconomic levels above and below the poverty line, we still see that those differences exist in terms of higher rates of maternal death for our Black birthing people. One of the things is that we know that there's a lot of social and structural determinants of health out there in the community that we're not measuring for. And that's something that we can definitely do better as a healthcare system to try to see what exactly is causing our patients to have such worse outcomes, because a lot of it happens outside of the hospital. In terms of the common causes of death of Black birthing people, we see it from eclampsia and preeclampsia, which are hypertensive disorders that you can get in pregnancy, postpartum cardiomyopathy, which is heart failure, obstetric embolism or blood clots, and obstetrical hemorrhage. And so one of the things we can do is just be aware of these conditions and the most common signs and symptoms associated with these conditions.
Along with what Dr. Sutton says, I would also like to add to that, with the healthcare problems that are associated to our Black birthing people, another thing that really affects their mortality and morbidity is the fact that 30% of minority moms and birthing people in the United States, compared to 21% of our white birthing persons, report mistreatment during the hospital visit. So implicit bias and explicit bias does play a huge role in these maternal outcomes as well. So that's a good reason why we're having these events for Black Maternity Week, to bring attention to the need to address the issues that exist in our healthcare system when it does come to implicit bias.
And if I may add, information that just came out yesterday, Vice President Harris convened the first meeting ever with the cabinet officials on maternal health. And so as some of you may know, the Momnibus Act from 2021, which was a very comprehensive 12-step program to reduce maternal mortality across the board for all and improve pregnancy outcomes, unfortunately did not get through the Senate. It was part of the Build Back Better bill, but as you know, that's stalled, and then Senate probably won't go any further. However, out of it, a portion of it was passed, which is geared towards veterans and looking at outcomes in the veteran system, which is a start. But hopefully, with what what Vice President Harris is doing in terms of revisiting this issue of maternal mortality in this country, we will move forward with some of these initiatives.
One of the most important tips I can give expectant mothers is to educate yourself. Take full advantage of the resources that are provided by your healthcare providers, your community websites. The more you know, the better off you will be when you do enter, the hospital to deliver. You'll understand what your provider is explaining to you, what your physician is saying to you. Ask questions, write them down ahead of time if you need to. Um, Bring an advocate with you, whether that is a doula or just a nosy auntie you may have, your partner. Bring somebody with you that can also act as your advocate, and speak up for yourself. It's your body, your birth, and please just communicate with your provider. We promote shared decision making in our environments. That means that the decision as to your care is a collaborative effort between you and your provider.
Yeah, I would definitely echo those statements. Knowledge is power. As Dr. Clunie was saying earlier in our live series, ACOG or ACOG.org and SMFM.org have great patient education materials out there that you can educate yourself. In terms of you are pregnant and you're worried about your own healthcare status, having those conversations early with your doctor is very important. Birth plans are, ubiquitous and very prevalent in the community. If you want one, you have things that are very important to you for your birth of your child. Bring those to your doctors early. Have those conversations early. And the last thing I wanted to say was that be aware of your own symptoms. Some of the things that I talked about before in terms of the big causes of Black birth and people getting sick, like preeclampsia, cardiomyopathy, or heart failure. A lot of those things present with common symptoms that people might not pay attention to. So, headaches in pregnancy, especially if they happen in the second or third trimester, make us very concerned. Right upper quadrant pain in pregnancy make us very concerned in the third trimester. If you're having chest pain, shortness of breath, swelling, those are symptoms that you should, talk to your doctor about or present to a hospital to be evaluated.
Yeah, and if I can just add on to that, those are all extremely true. And I think, like we all see, like you all said, education is the most important. But also, if you don't feel like you're being listened to, don't be afraid to find another provider. I know pregnancy is a period of time of months, but if you don't feel like your provider is listening to you and you feel like something is not right that they're not catching, don't feel uncomfortable going to another provider. We all welcome that. Hearing from patients who just want to ask us a question about their care. That's all very welcome. I mean, I can't tell you. I had a colleague of mine who delivered and postpartum. She also just didn't feel right, but her doctor said, "Oh, things are okay, things are okay," and she went to someone else. And unfortunately, she had to go out. After that, all that time, moved to someone else, and she eventually had postpartum preeclampsia. And so it's very important. Listen to your body, like Dr. Sutton said, and don't be afraid to talk to someone else if you think you need to.
Well, I would say examples of effective communication between health providers and their patients is to listen with empathy. Put yourself in that patient's shoes and treat that patient the way you would want to be treated. You want to try to learn strategies to manage any conflicts you may have with a patient, because you don't want to escalate a situation or make assumptions just based on a patient's appearance or where they receive their care. So definitely formulate a strategy to also deconstruct any personal biases you may have. We really need to look within ourselves and work on ourselves and our own implicit biases, because if we're not aware, it could manifest in the way we care for our patients. So it's very important to realize we're all human. We're all influenced by media out there, social media, and experiences that we've had throughout our lives that may potentially affect the way we care for our patients. So we have to do the work on ourselves as well by taking full advantage of whatever implicit bias programs that your institution has, or going ahead and taking a course on your own, reading literature, reading up on the community that you're serving, and getting involved in that community as well.
Yeah, and I would say, a good the sign of a good, effective communication between a provider and a patient is one in which the patient is actually heard. If a provider is not letting you get your thoughts or your questions out, then that's probably not the best provider for you. I love personally when patients take notes on their phones and come to me with a list of questions, because then I know I'm answering all their concerns. So don't be afraid to do that and to have those questions like up and ready for your prenatal visits. No question is too small. Your time with your doctor is your time, so you should use it to get your questions answered.